Hi there, and welcome back to another COVID-19 webinar hosted by the American Society of the University of Haifa. We're joined once again by Dr. Manfred Green, Director of University of Haifa's International Master's Program in Public Health and Global Health Leadership, to provide you with the latest news surrounding the COVID-19 pandemic and to answer any questions that you might have. Dr. Green, great to have you with us as always.
Thank you very much, Jake.
So here in Israel, we're currently in the midst of what many are calling, another surge or another wave, due mainly to the new Delta variant. 6 weeks ago, there were about 200 active COVID cases, and now there are around 11,500, I believe. And for the first time since March, the positive test rate is above 2%, despite, I believe, Israel having about a 60% vaccination rate. So the Israeli government recently reintroduced the Green Pass system, limiting indoor gatherings to those who are vaccinated or those who have recovered from COVID or who present a negative test. Prime Minister Naftali Bennett has warned also that unvaccinated individuals may even have to start paying for their own COVID tests. Do you think this is a good strategy to get unvaccinated individuals vaccinated? And what else do you think might be able to be done to move that needle to get people vaccinated?
Thanks, Jake. Well, basically, the pandemic and the epidemic in Israel is going to continue as long as there are people who are not vaccinated or who are not immune. They may have been sick and became immune. So we need to boost the max vaccination rates, and that should be our prime goal. There's still probably 1 million adults who are not vaccinated, and then there's still the children who are not vaccinated, particularly under 12 and some of the 12 to 15. So basically, again, we need to very much target these people. And that, I think the strategy of the so-called Green Pass or whatever is where you need to demonstrate that you've either been vaccinated or you have a negative test in order to go into certain restaurants or closed environment. I think it's a good strategy. The question is who pays for the test is always a difficult one to answer, but at the moment where the vaccine is available free, I don't think it's too much to ask people who are for some reason not taking the vaccine that they should, in terms of going out basically to areas where they choose to go and visit, like restaurants, that they need to have tests, or that they should pay for these tests.
Right. And a recent study that was just released a couple of days ago, I believe, it was revealed that the Pfizer vaccine is only 39% effective in Israel at halting the transmission of the virus, but still over 90% effective at preventing serious illness. So, how worried, I guess, should vaccinated people be right now in getting COVID?
Well, the vaccine is still very effective, and as you pointed out, it's particularly effective against serious disease. So people who have actually been infected, and there are people who've been vaccinated who've contracted the infection, because the vaccine is not 100% effective. By and large, they've had mild disease. There have been some, though, with more serious disease, but by and large, it's a good vaccine and a very effective vaccine. So I would say a combination of being vaccinated and being cautious. In other words, not exposing yourself unnecessarily. I still believe in using masks in close places and a little bit of social distancing where you can. So if you do that, you probably, I would say you're in a good place.
And the idea of a booster shot is currently widely discussed. Israel is the first country to approve a third shot for the immunocompromised, but recently, with the spread of this Delta, it's more broadly discussed for everyone. There's currently a debate as to whether a third shot should be offered now, or should we wait until something is designed more specifically tailored for this particular variant. What are your thoughts about a booster shot, or perhaps something that is designed specifically for this Delta variant?
Right. Well, when I hear people talking about the booster shot, I think it's important to point out that booster shot should not be considered to be some kind of random event. I think it should be put in the framework of a policy, and that's what we do with other vaccines. So you just don't randomly boost people. You actually do it as part of a program, a schedule of vaccination. So if we really believe, and there are two factors now that will help us to believe that the vaccine, that there is a need for a booster shot or another shot, then there are two main factors. The one is that there's an increase in illness amongst people who've been vaccinated. And the other is that we're seeing a decline in antibodies and antibody levels in the people who've been vaccinated, or maybe those who've been ill. So if we're seeing those two factors, we then have to put it into a policy. And the policy should be, and I'll tell it to you just in a few words, you have to decide who you're going to vaccinate, what kind of schedule you're going to use. In other words, is it going to be, for example, you have two initial vaccines that say 0 and 3 weeks or a month, and then another one at 6 months, or whatever interval is chosen. Or you actually decide just to vaccinate everyone who's been vaccinated with only 2 shots. I would certainly not recommend the second, because I don't think that somebody who was vaccinated with their second shot a month ago needs to have a third shot. So I would guess that the actual policy should be to define an interval. In other words, say, if you've been vaccinated more than a second shot more than, let's say, 5 months ago, if we choose that schedule on a kind of 0, 1, and 6-month schedule, then that's time for a booster shot, primarily to the elderly at this stage, elderly being, you could argue about the term elderly, but older people over the age of 60, 65. And that should certainly, we hope, impact on the severe mortality. One other thing you asked is, should we wait until there's a better vaccine, or a vaccine that's more tuned to the mutant, the Delta particularly? And that's certainly a consideration. So, again, you'd ask yourself, should I get a booster now or wait 2 months or 3 months and wait for the Delta, or it may take a little longer? I think this has to be defined as a national policy, and I think this needs to be developed very quickly.
And then just for those like myself or our audience that aren't epidemiologists, I mean, can we expect another variant after Delta? I mean, will these variants just kind of keep popping up and coming? I assume the Delta won't be the last variant that we see in COVID, right? I mean, where does this end, I guess, if there is such a prediction?
All the viruses, and particularly the RNA viruses, and this is so-called an RNA viruses, their tendency is to mutate, to change, to become slightly different. Much of the time, it may be a very small difference. When they replicate, they make mistakes or whatever. So there may be some mistakes there, but that may not impact on the immunity. In other words, your vaccine that you've received may still be fine. Or if you've been exposed previously, that may be fine. It's when there's a change that's significant enough to make it difficult for your body to recognize that virus. In other words, it's a significantly different form of the virus. That can happen quite frequently, and it has been happening with this. Although, other RNA viruses do much the same, hepatitis C, others, that were influenza, for example. So again, we have to see to what extent, again, if we vaccinate a lot, then we can reduce the circulation of the virus, and that reduces the chances of mutations. So again, vaccine is very much a key to helping to solve that problem or reduce that problem.
Right.
But we need to keep an eye on that, as we do for influenza, where we keep modifying the vaccine.
Mm-hmm. And I think there are about 115 or so very serious cases here. It doesn't look like the hospitals are being overran with patients. It seems like our healthcare system can handle the load right now, but cases are rising at a rapid pace. Assuming that the numbers continue to rise, but the vaccine is still quite successful at preventing serious illness, do you expect more restrictions to be put in place for Israelis over the next month or two if numbers do still increase?
Right. First of all, you're right. There's been an increase in the number of serious cases. Fortunately, there hasn't been a large increase in the number of deaths, although there has been, which means that the hospitals are coping. and the patients are doing okay, most of them. That doesn't mean that it's not a cause for concern. Obviously, if it keeps increasing, then that'll put pressure on the health system. And again, we'll start seeing more, much more serious cases. So that's something that we need to bear in mind. But on the other hand, we need to keep the country going. We need to keep society going, and we can't keep everyone closed in indefinitely. So I think we need to find a good intermediate path. As I said, masking, I think, is a very useful way of keeping down the number of cases, in my opinion. Some kind of social distancing. I think the schools are a major area where they must improve ventilation in schools, and I've said that on a number of occasions. Use filters in the ventilation. These should be installed as a long-term investment, so it's good to do it now. And again, just try and get people vaccinated. That's the people who are not vaccinated are causing problems for society. It's hard.
Yeah.
I know it's not good to blame people, but it is an issue. I mean, it's a real issue when we have unvaccinated people. That's a source of infection.
Yeah, absolutely. What do we know at this point about what they're calling the Delta Plus variant? I think I read today that there's been, I don't know, 15 or so cases that have been identified in Israel of what they're calling a Delta Plus. What do we know about that, about that sort of variant or that strain?
Right. Well, you know, the Delta is a form of the Delta variant, and the Delta variant, the problem with it is that it spreads much more easily, so it's more difficult to control. And again, we need to watch that very carefully and make sure that it doesn't spread too widely as far as possible. It's clearly very difficult to avoid the spread, but you can limit the spread and people can protect themselves. So the fact that we have another one that they call Delta Plus, the Alpha, Beta, Delta was actually a Gamma or whatever, was a way very nice way, by the way, of WHO to help us with the names of the variants, because I don't know if you remember, we had to remember numbers like the BX275 or whatever. And you had to remember that combination of numbers and letters. And that's now been reduced to Alpha, Beta, Gamma, Delta, which is much more convenient. Mm-hmm. So we're basically just looking at another variant and basically making sure, essentially making sure that it doesn't spread too widely.
Mm-hmm. England's Prime Minister Boris Johnson seems to be taking a bit of a peculiar approach as the Delta variant rises in his country and really around the world. England's decided to basically lift all of their COVID restrictions. I think they had a celebration called Freedom Day even last week, if I'm correct. What is their rationale for lifting the restrictions as numbers seem to be becoming a little more worrisome? And do you agree with it? Kind of what's the rationale for that?
Well, if you think about it, containing this pandemic actually requires a huge amount of patience, and people are suffering also because of the restrictions. I mean, losing their jobs and, a lot of economic difficulties, also the children not being at school part of the time and so on. So and also basically going out and enjoying themselves. So I think there's a level at which the public also finds it very difficult to have these kind of restrictions imposed on them. And whether they say it aloud or not, they almost say they're prepared to take the chance of severe illness and sometimes death, in order to get back the so-called freedom. So this is a real public issue, a public health, but also a public issue. I think what they're doing in the UK particularly is they're saying, look, we know there are going to be more cases, and I've seen it also in the UK data. There's an increase in the deaths, although that happened a little bit before there was an increase or reduction of restriction. On the other hand, someone has told me that seems to be somewhat of a decline in cases. So it's a mixed picture, but I have a feeling anyway that Johnson also has said, I mean, it's all my feeling, that he'll still say to people, wear masks if you're going in public transport and where you can in closed spaces. So kind of try and get that middle path where you can still live a good, comfortable, enjoyable life with minimal restrictions. And my opinion is that masking is still a minimal restriction. Some would argue with me on that, but that's my opinion.
Mm-hmm. Mhm. Okay. Thank you so much, Dr. Green, as always, for your insights. I'm afraid that's
Thank
all
you,
the time
Jack.
we have for today. But as always, to our audience, if you have any questions at all for Dr. Green, please leave them in the comments section of this video or email them to info@asuh.org. We'll be happy to address them on the next update. And hopefully the next update, we can talk about some positive news and positive developments.
Hey, can I make one final comment?
Absolutely.
No, there's just, I think I said earlier that I think that people who are not vaccinated should pay for the testing. That's an issue which I think still needs to discuss, because on the other hand, I really believe that there should be a huge amount of free testing available for the public. I think that's a good way of controlling the epidemic. And I've seen that in some places. Somebody said that in Germany, on practically every street, there's a place where you can go and get tested. We have to make testing very much accessible to the public. So it's going to be a fine line drawn between, demanding some kind of payment which is going to restrict the use of testing and actually extending testing. So it's not a simple one,
Right.
easy solution.
Right. Absolutely. Thank you so much, Dr. Green. We really appreciate your time.
Thank you.